Hello, everyone, and welcome to the Radiology Cardiothoracic Imaging podcast. My name is Sonia Barra, and I'm the editor-in-chief of the journal Radiology Cardiothoracic Imaging. The host of our podcast is Praveen Ranganath from Dallas, Texas.
Hey, Dr. Ibarra. Hello, everyone.
Hi, Praveen. In this series of podcasts, we will break down recent articles and trending topics from the journal through conversations with the authors, the editors, and experts in the field. For all of you out there interested in cardiothoracic imaging, subscribe and listen to the podcast to keep up to date with recent developments in cardiothoracic imaging.
Hello, everyone, and welcome back to the Radiology Cardiothoracic Imaging podcast. On today's episode, we will be highlighting a recently published paper in the journal focused on a thoracic radiology pathology correlation of COVID-19. The paper is titled Lethal COVID-19, Radiological Pathological Correlation of the Lungs. This is an extremely timely and interesting work that comes to us from our radiology and pathology colleagues in Basel, Switzerland. The lead authors are Dr. Maurice Henkel and Dr. Thomas Weichert, and the senior author is Dr. Alexander Sauter. This original science publication is a single-center retrospective study of the CT and autopsy findings in 14 patients who died from complications of COVID-19. This study took place between March 9th and April 30th of 2020, which is relatively early in the pandemic timeline. The goal of this study was to correlate the CT findings with the pathologic findings to further our understanding of COVID-19 pathobiology. Without getting too into the nitty-gritty of the numbers, I'll try to summarize the general force of the results. The ground glass opacities and consolidations in COVID-19 infection, now well known to imagers across the world, corresponded with a variety of histopathologic findings at autopsy. Some of those findings included the following: diffuse alveolar damage, capillary dilation and congestion, interstitial edema, and microthrombosis. As you can see, vascular abnormalities were very prominent in the pathologic correlates of CT findings. Now, I love RadPath correlate studies like this. It's one thing to see and describe these ground glass and consolidative opacities that are now all too common on chest CTs, but really understanding the underlying pathology provides greater personal and societal impact to cardiothoracic imaging. To help us better understand this very important study, I have the pleasure of having the authors Dr. Maurice Henkel, Dr. Thomas Weichert, and Dr. Alexander Sauter on the podcast with me. Let's jump into my conversation with them now. All right, welcome back, listeners. I have with me the lead and senior authors of our featured paper. I would like to introduce Dr. Maurice Henkel, Dr. Thomas Weichert, and Dr. Alexander Sauter. Guys, welcome onto the podcast.
Thank you for having us.
Of course.
Thank you so much.
Perfect. Hey, guys, could you tell us a little bit about yourselves? Where are you from? Where are you currently working? And what are your areas of academic interest? Maurice, why don't we start with you, and then we'll go to Thomas and then Alexander.
Yeah, thanks for having us here. My name is Maurice Henkel. I'm from Germany. And during med school, I already worked 5 years in radiology. After med school, I started my residency in pathology for 1.5 years. And my academic interest is actually radiology pathology correlation. So as a research fellow, what I'm right now, I'm working on projects how integrated diagnostics between radiology and pathology could look like.
Excellent. And Thomas?
Yeah, hi, my name is Thomas Weichert, and I'm the corresponding author of the study we'll discuss today. And currently I'm resident at the Department of Radiology at the University Hospital Basel, like the other guys. We are located in beautiful Switzerland. And my personal area of academic interest is the development, validation, and translation of new technologies into radiology workflows and clinical workflows. So maybe just to give you an example, we conducted a study on an algorithm for automated detection of pulmonary embolism and are currently gathering data on its impact on radiology workflows. So that's what we do. And the study we'll discuss today was radiological pathological correlation of the lungs and lethal COVID-19. And it's a result of a close cooperation between three partners. That's the departments of radiology and pathology at our university hospital, and also of the Department of Pathology of a partner hospital in the region. So, I think now it's left to Alex, the senior author, to say some words about himself.
Yeah, thank you very much. So I'm Alex Sauter. I'm associate professor in the cardiothoracic imaging department here in Basel. I'm also deputy research coordinator here. And yeah, we have a special focus here on machine learning applications in imaging. And yeah, we would like to find meaningful imaging-derived biomarkers that we can then use to help our patients.
Excellent. Well, Maurice, Thomas, Alexander, thank you all for joining us on the podcast. I'm really excited to discuss this really important paper. To review, your study is a radiologic pathologic correlate showing how lethal COVID-19 has affected the lungs, in particular focused on the autopsy findings in correlation with their CT findings. This was a retrospective study on 14 patients. It was conducted between March 9th and April 30th of 2020. This is relatively early in the timeline of the COVID-19 pandemic in Europe, if I'm not mistaken. So to help us get a little better context as listeners, can you talk to us about the circumstances in Europe around that time of your study? Alexander, why don't you take this one?
Thank you. Yeah, I'm happy to illustrate the time we were in. It was the time of the first peak, and we heard initial reports from China about the first cases, and then it came with the spread through northern Italy, and then we suddenly realized, okay, we have a global problem, and we had the first patient SARS-CoV-2 positive in February 25. So then we really realized that there's something going on. And then it came to a cancellation of the Carnival of Basel. In German, it's called Basler Fasnacht, which is quite important for the local people here. And it actually never happened before the Second World War that there's a cancellation. And then in March 16, we had the official lockdown in Switzerland, and then subsequently a cancellation of the planned program in the hospital. However, our department was still quite busy because we did a lot of chest CTs, especially in the symptomatic patients, because in the first time it was not clear how the performance of RT-PCR test was. We had also a lot of long turnaround times, and sometimes they were false negative. And also our colleagues from pathology were very busy at that time, and they did the first autopsy, despite there were some concerns from organizations that are regarding infection protection, but they started to do it. And they developed a special autopsy protocol with a lot of protection devices. So we then realized later on, it was then the end of April, that there's a lot of autopsy going on, a lot of CTs, so why shouldn't we take the opportunity to learn from each other? And that's how we started the study.
That's brilliant. A lot of that resonates with us in imaging, and specifically as well as healthcare in general. The early time of the pandemic was pretty frightening in terms of how to address this pretty devastating healthcare problem. The way in which you've tackled it is very elegant. What I'd like to do now is ask Thomas, what makes your study on the thoracic radiologic pathologic correlates of COVID-19 unique relative to other studies that might be out there?
Yeah, I think, and we already talked about that, is that we were very early in the timeline of the COVID-19 pandemic. So to our knowledge, we were the first structured morphological comparison of antemortem CTs and postmortem cross findings and histopathology. And that at a time where many details regarding the pathophysiology were unclear. So I think that is a very important point. And then second, and also very important when it comes to these correlations is that CT and autopsy were performed within a relatively short period of time. Yeah, so we had not a lot of time between the two, so the correlation was actually possible. And then third, I think it's very special that we were able to publish the complete image data that forms the basis of this study to anyone, right? We share them with anyone. It's online. All it needs is really a single click on a link in the supplement, and then you can review the complete stacks of CT images as well as the digitized histological sections. You can zoom in, zoom out. So that's really good. And I think it's a very fascinating way for the readers of the paper to interact with the data, right? And yes, and maybe you have a look at it, and then you'll see that we used an e-learning platform that is called RepMed, right, to publish this data. And this is actually also a project where Maurice maybe can say a few words later. And yeah, so I think that's really a special thing, right? You can just go and see the data in detail.
Excellent. It's providing an immersive experience for us interested in cardiothoracic imaging, especially encountering more and more COVID-19. Here in the States, I presume is similar to there in Europe, and we're having our second surge at present. Let's get into the paper now itself. You all do an excellent job of systematically comparing the radiologic findings with the gross and microscopic pathologic findings. Importantly, this was done on a lobe-wise level rather than a patient-wise level to be more granular. Maurice, could you briefly talk to us about how you compared the CTs to the pathology findings?
Yes, sure. So in general, the difficulty in correlating an inflammatory disease such as COVID-19 is its temporal and spatial heterogeneity of the disease itself. So there could have been hours and days between the CT and the autopsy, which means that the inflammatory process already changed severity or its localization, right? And that makes radiopathological correlation of inflammatory diseases more challenging compared to other diseases like solid tumors. And in order to make statistically valid statements, we examined whether certain patterns show a correlation across this temporal and spatial changes. And we therefore reviewed the presence and the severity of each pattern individually in each lobe in a consensus review of two board-certified experts. And then in the end, we correlated all of these findings and all lobes across radiology and pathology, also the severity. And yeah, so that was how we've done it. To cope with the difficulties.
Excellent. Yeah, beyond just even writing the manuscript itself, just performing the study has additional difficulties, given the context of it being in the peak of the COVID-19 pandemic first wave. The images that you provide in this paper, comparing the gross and microscopic specimens with the corresponding CT, they're really beautiful. I highly recommend our listeners out there to check it out. Our imager audience is probably very familiar with the ground glass and consolidative opacities that are present on CTs of the COVID-positive patients. Can you talk to us about the histopathologic correlates of these ground glass opacities and consolidations?
Yes, sure. So what our study was able to show is that both the ground glass opacities and consolidation are caused by a multifactorial mixture of pathologies. So there was not a single cause, and the most prevalent histopathological pattern that we observed was an exudative phase diffuse alveolar damage, which is characterized by capillary congestion, edema, and intraalveolar hemorrhage. And we also saw, which is also part of one sign of an exudative phase DRD, we saw hyaline membranes. And in addition, the lungs in general, they showed microthrombosis, and in later stages also proliferative phase DRD and superimposed bronchopneumonia. What we did not see, what was under discussion at that point in time, were fibrotic changes. which we can explain due to our collective. We only studied on lethal cases of COVID-19 patients, so there were no patients that survived for a sufficient period of time to develop the fibrosis.
Interesting. So to summarize, your findings suggest that COVID-19 pathophysiology is a complex interplay of acute lung injury and vascular abnormalities. I found the vascular component pretty interesting here. Can you talk specifically about those vascular findings you identified on CT and pathology?
Yeah, sure. On CT, we had two main vascular findings. One were enlarged pulmonary arteries. So we saw that in around 90% of the cases. And then we also saw generalized vascular thickening. That is enlarged vessels within ground glass opacities and consolidations. So what we found in histopathology were microangiopathic changes and also microdrombi. So maybe that causes just an increased intravascular pressure, right? And could explain these findings that we saw on CT. And then maybe also of interest to the readers and listeners, we found some evidence that CT might underestimate the prevalence of pulmonary embolism in COVID-19 because we were able to identify emboli in only one of the 14 CTs, right, on CT, but found microdrombi in 50% of the patients, according to histopathology. To this, we of course have also be aware that we had only 5 CTPAs performed, and the rest were performed without contrast. So, but still, I mean, that might be a problem in this, right? Yeah.
Yeah, and that speaks a lot to the refractory hypoxemia that is seen clinically in these COVID-19 patients.
Yes.
Maurice, is there anything that you'd like to add with regards to the vascular findings that we see on CT and pathology?
So actually, this is one of future projects that we are going on. So during the pandemic, we didn't specifically assess the vessels. So what we are trying to do next is we want to perform image-guided autopsies. That means before the autopsy, we review the CT, right? And then we identify that areas of interest that we want to assess, and we will then perform an autopsy, especially to look at this changes. So this was one of the limitations of the studies as well, but that was one key takeaway from us for the study, and this is also what we address in the future study. So we are currently collecting cases where we are doing image-guided autopsies.
Excellent. And Alexander, can you give us an idea as to the future outlook of the work you'd like to be doing, as well as what you think is going to be the direction we go in terms of COVID-19 radiology pathology correlation?
So Maurice has already introduced the study that we are performing now, the image guidance. What we are also doing is we developed an automatic opacity quantification with fixed HU thresholds that is also now used clinically in our institution. It was recently published by a colleague from us. And now we are looking a bit closer into histogram parameters derived from automated lung segmentation and also fixed HU thresholds, which one really reflects clinical severity best. We are also performing a study. Imaging is just one part of a whole pathway of a patient. So of course, patient management is very important, and especially like ICU resources. And we are now trying to do a prediction model using our imaging parameters to predict if a patient needs ICU treatment or not. And then, of course, we want to look closer at these vessels. We are doing a vessel segmentation automated, and then we are trying to, get more quantitative data out of our CTs. And we also use our RepMed platform more and more to also share annotations of special patients, to share this with colleagues and to learn every day a bit more.
Guys, that's really exciting. It's a nice combination of applications of artificial intelligence with education in the context of cardiothoracic imaging and COVID-19. Hey, Maurice, Thomas, and Alexander, I wanted to really extend my thanks for sharing your time and expertise with us here on the podcast. Thank you so, so much.
Thank you.
It was also a pleasure for us. Thank you, Praveen.
Of course.
Yes, thank you.
Of course, of course. And to our listeners out there, I highly recommend you get your hands on this paper that is now published in the Radiology Cardiothoracic Imaging Journal. Once again, I am your host, Praveen Ranganath, and we will see you next time.